Hair restoration at about face actually started on a very personal level. When I hit around maybe 40 years old, I started to notice that my hair was starting to thin. I would have spent any amount of money and tried any topical lotion or potion to try to get my hair to grow or to stop feeling like it was falling out or shedding. To be able to offer something in this practice that was cutting edge, that didn't require any downtime, and that actually provided results was something that was a motivating factor for me. And we offer two forms of hair restoration here. We offer platelet-rich plasma, or PRP, which is really the most natural thing that we offer in the office, in that we're actually drawing a blood sample, we're spinning it down, and then taking the plasma out of that blood sample and either injecting it into the scalp, or we can also use a microneedler, which essentially helps to stimulate, heal the scalp, and therefore make it a better environment for hair to grow. The second modality that we offer is TED, which is short for Transepidermal Delivery. And TED is actually a really magnificent cutting edge technology that helps to stimulate the hair follicle, completely painless, no downtime. Patients come in with clean hair. We use the ultrasound on their head in the areas that they're most concerned about, and then we apply a patented serum, which is what actually helps to stimulate some hair growth. We recommend a series of treatments. With one treatment, you may or may not see some growth. Or some change in the amount of shedding. After their third visit, they report a decrease in shedding, an increase in growth, small little baby hairs that are starting to grow. Then we would put you on a maintenance program, making sure that we're maintaining that healthy environment for the hair to continue to grow. We've seen amazing results with TED. Because TED is so safe and so minimally invasive, the preparation that patients have to do is essentially nothing. And while hair loss may not be the initial concern when a patient walks through the door, we pride ourselves in making patients feel comfortable.